This video is part 3 in our educational series on how to utilize a conservative treatment approach by treating soft tissue restrictions for a client who has degenerative disc disease of the cervical spine. In this video, I will cover the following: understanding the concept of decompressing the disc by treating surrounding tissue restrictions, a breakdown of the function of the levator scapulae muscle and why dysfunction is common in degenerative disc disease, advanced palpation and function-based treatment methods for the levator scapulae, and the importance of getting the treatment dosage right in the beginning. For those of you who don't know me, my name is Dr. Matt Maggio, and I am a soft tissue injury treatment expert specifically for chronic neck, shoulder, and arm pain. My focus is on finding and fixing nerves that get stuck to muscles with a glue-like substance called adhesion, also known as scar tissue, and reducing inflammation from chronic pain. Without the use of drugs, injections, or surgeries, this leads to a significant increase in overall functioning, flexibility, and long-lasting pain relief. I'm also the creator of the Peak Method, where we teach overworked manual therapists a new injury treatment system that eliminates the frustrations of not getting consistent results, allowing them to reduce their treatment times by at least 50% and easily double their income. All right, so welcome back to the degenerative disc disease treatment series, specifically for cervical spine. This is part 3. If you haven't watched any of the other parts, part 1 or 2, I'll link it up top here if you're watching on YouTube. If not, it'll be down in the description box below, so you can go back and review all that and get some concepts about what's going on. But this week, we want to really get into some treatment and some what I call decompressing the disc by treating the surrounding tissue. So I talked in earlier videos, a lot of times the disc is the effect, it's not the true cause. So what we really need to do is decompress that and like take the pressure off of there. So disc disease, as I've said throughout this entire series, is usually the effect, not the cause, especially when we don't have like a direct injury or trauma to the area. A lot of times it's just that repetitive overuse, and then the discs eventually get beat up. Like I said, it starts in the muscles, then gets to go to the nerves. The force has to go somewhere, then it goes to the disc. I talk about this a lot when I'm explaining things to my clients or when I'm explaining treatment. I always say, think of your disc as like your thumb, and it's stuck inside a car door. The car door is all the surrounding bad tissue. You have to get this car door off of there before you ever allow this to heal up or get a chance to just get better. And a lot of times, like I say, when people go and like have surgery right away, they basically are just like, it's like they pulled that car door back and they pull the thumb out of there real quick, but then that car door slams on there as well. So that's what's happening so much in the medical model, is they're treating so much of the effect, but not the cause. So in order for it to get better and actually improve, we have to get in there and treat the soft tissue restrictions around the disc. What does it mean to decompress the disc? It's really just kind of taking some pressure off of there, because when you have all that adhesion and scar tissue built up in the muscles and the ligaments around the nerves, it makes the area less flexible. It makes it weaker, and the force has to go somewhere. So it goes to the discs and the joints, and then they really get beat up. Now, a lot of the chiropractors do this thing called like decompression, where they hook you up to some fancy table and it kind of tractions you out. What that does is it temporarily relieves some stuff and, kind of plays a trick on the brain and the body to let things kind of chill out a bit, but doesn't actually fix it. For us, we're going in there and actually identifying and finding those soft tissue restrictions, getting proper depth, proper tension on them, and actually getting rid of them, which in turn restores function, flexibility, and strength back to the area and takes the pressure off of the disc. That's what I mean by decompressing the disc. So the first muscle that I usually end up seeing having a huge role in disc injuries and disc problems is going to be the levator scapulae muscle, aka the giant knot in everybody's neck that never seems to go away. So the function of the levator scap, it's kind of interesting how they named it. Literally to elevate the scapula. That's all it does. It's supposed to elevate the scapula. But what happens is when there's a lot of dysfunction in the deeper part of the neck muscle, maybe the ligaments in the neck, nerve entrapments as well, the levator scap ends up being like a secondary stabilizer to the neck, and it ends up doing like extra work. So what happens is it ends up doing the work of the shoulder and also the neck, and it just gets really, really beat up. And then it develops a lot of adhesion. So basically what happens is it never gets a break, and those muscles are constantly contracted. When they're constantly contracted, they don't get enough blood flow, they don't get enough oxygen, which in turn causes the body to start to lay down that adhesion or that scar tissue with like immature collagen fibers, makes the area less flexible and weak. I always say, imagine if you walked around and flexed your bicep all day, it'd be pretty damn tired and pretty beat up. That's what's happening for people that have neck problems, chronic disc disease, that levator is just never shutting down. And a lot of people encounter that. They call it like a knot or tension. They think it's a trigger point. It is not a trigger point. This is not a trigger point. It's adhesion. It's totally different, and the treatment is way different as well. So what I want to link up first is a detailed palpation of how to actually find the levator scap in the area, because a lot of people don't encounter it or don't find it correctly. So I'm going to link up a video directly from one of our advanced training courses to see how I go about using landmarks to find that area. So I'm going to link that up right now. The key is going to be to find where that levator lives. So a lot of times in the anatomy books, they have the levator coming out and making like a weird J motion in there. It doesn't actually do that. It actually goes straight back and straight through. So the way I find where the levator goes is I usually find from that superior angle of the scapula and go through here. And a trick that I do is I bring the neck back, and you see how it creases in here when we bring the neck back. That allows me to get my landmark of where I want to go. So that's a little trick that I do. So now we know that, and I'm going to be there. All right, so just a couple take-homes from the palpation video. A big thing is you just want to slow down. You know, you're not in a rush, because if you can't find it, you can't fix it. So using landmarks, slowing down is going to really make your treatment process a lot better. You know, so many manual therapists just want to do a ton of treatment and not really slow down. If you slow down, you do it right, you get the right amount of treatment every single time, and you know where you are, because if you can't find it, you sure as hell can't fix it. Next thing, what I want to demonstrate and show in this training is me actually doing an advanced treatment to the adhesion, getting proper depth, proper tension, and breaking that down. You know, like I said, a lot of people think this is a trigger point, but it's not. The treatment is way different. It's more specified, more precise, more focused to actually break that down. So I'm going to link that video up right now. I'm going to be there. And what I'm going to do is have the client bring their head back just like this. And now I'm going to go through my motion and my palpation. And then when I'm ready, the client is actually going to drop their head down very slowly into flexion. And this is called internal slide on the tissue as we go. And we're going to go nice and slow. So one thing I like to do for the levator is I like to come at like a 45-degree angle in through here, 45-degree angle as we come through. So what I'll do is I like to use my outside hand, and it's here, and then I find that crease in the neck. Then I know where I'm at, and it puts that muscle in a shortened position. Now I come through, I approach here, my outside hand is right on the top here, and then my inside hand is here, and that actually backs it up. And I create what's called like a lock-in key, where my thumb goes in there and protects it. So I'm here, here just like that, and then I'm going to come in like that, and I'm nice and relaxed. And the first step that I'm going to do is I'm going to go up on my toes, and then I'm going to sink straight down to the floor. And that's what's called my first depth as I go. Now my second depth is going to be with this non-contact hand. I'm going to get in there and do a pec push, just like that, and that gets me more depth. Then I'm going to back out about 5 or 10%, and the next thing I'm going to do is pull my lats back like that, and then I'm going to do what's called a hip hinge and drop my butt back like that, and that increases my tension. Now it's loaded, and now I have the client drop their head very slowly. And as they're dropping their head very slowly, I'm keeping my depth and dropping my butt back as we go, and keep going, keep going, keep going, until they reach down and touch their chest. This area is very dysfunctional. We have to account for the different changes in the anatomy and where you are. And you can see how deliberate I am. I come in at 45. It's a very slow and in-depth process as we go, as we're generating the tension and going in there. But if you can effectively find and fix scar tissue in here, what that's going to do is decompress the neck and take a lot of pressure off of the discs and the joints in the neck. And this area is usually very beat up, and a lot of therapists want to get in there like with their elbow, or they want to get in there and be too compressive. And I always say, if you're treating scar tissue, think of it as like a rubber band. And if I put a rubber band on the floor, I can jump on it, I can drive it over with a car, it's not going to break. What actually breaks it is that tension, and that's what we teach, is getting proper depth, then tension, using your body so you can work, what do I always say? Work smarter, not harder. So that's the levator scap. So just a couple take homes from the treatment side of things. You can see it's very slow, it's very deliberate, It's very focused. A lot of clients will describe it as like a hurts but good, but nothing like too excruciating or too painful. And a lot of times what they'll notice and they'll show and say is that like it just feels like a pressure valve was let off. And that's where that decompression goes. Because when you release all of that adhesion and that dysfunction in the levator scap, it just takes the pressure off everything and things just start to feel a lot better. They feel a little looser. Their head just doesn't feel as heavy. It really makes a big difference right away. So next is just the importance of getting the treatment dosage right in the beginning part of this. As I said in the earlier videos, a lot of times we make the mistake as soft tissue providers of thinking everything is just soft tissue related, but there's also other components like the degeneration there as well. The biggest mistake, and I made this for years, and I see this with manual therapists all the time, is they think treatment can only go two ways. They think it can either make the problem better or it won't do anything. They never considered that if they actually treat it too much, it can make the problem a lot worse. So I would say treatment is like a medication. You want to get enough to be effective, but if you overtreat it, you can actually make it a lot worse. No one ever thinks about that. So I kind of tread lightly in the beginning here, especially if I'm dealing with a chronic neck problem, chronic neck pain. I'd rather do less than more because you can't really come back for more. Usually what I say is for each side of the levators, I'll probably get what I call 3 to 5 awesome treatment passes where you slow down, you load it up, you redo it again. I'm not just like going through like crazy and trying to treat a bunch of stuff. I'm really just focusing in on that area and the treatment that it really needs. And I go real slow. I'll do a treatment pass. I might even have the client stand up and walk around a little bit, then do another one, let it chill out again, do another one. And then I'm probably done for that day because I don't want to push my luck because you can really load those discs up if you do too much and you push it too far. Now, lastly is why more treatment is bad with those with degenerative disc disease, because a lot of times, and you'll see in the movements and the treatments, they're dropping their head a lot, they're going in there, and it can put some more extra pressure on those discs. The other thing is like going back to that analogy about the thumb in the car door. When you first if your thumb's been in a car door for years and we remove it, it's going to hurt a lot in the beginning. So we want to just gently open that up to let the tissue accommodate, let the body accommodate, so we don't feel like we're doing too much. Then I always get into the test, the treat, the retest. So basically what we do is we do our test, then we treat it, and then we retest it. We see if it's better. We ask the client, hey, how's that moving? Does that look better? Does it feel better? We take the picture, we do the photos. We're really getting into that objective data instead of just being like, hey, how do you feel? We want to know how they feel, but showing that as well. And that lets us know that we got the treatment dosage right. We were on the right spot, got just the right amount of depth, just the right amount of tension, and had an effective treatment pass. Then at the end, I do what's called a first treatment recap and what to expect. I say, hey, we went in there today, we opened up the muscle, took the pressure off of there. A lot of times when we treat it the first day, it feels pretty good. You get some blood flow, you get some oxygen to the area, it feels pretty good. Usually what will happen is the next day it feels a little sore. In some cases, maybe 10% of the time, it can feel a little bit worse. If anything feels off, just give us a call or shoot us a text and we'll talk you through it. It's really helping setting the expectations of the client about what you did, what to expect, telling them what not to do in between the treatment as well. Because a lot of times we think, oh, the client just comes in, we treat it, and then they can go back to their life. But hey, if they got bad disc, and then all of a sudden their neck's feeling better, and then they're like, I'm going to go do a hard yoga workout or a hard CrossFit workout, and then they get all flared up, and then they blame you. So if you tell them, you got to remember, keep it very basic. This is what we did. This is what I need you to do. This is what I need you not to do. And you have to explain it very specifically, and no gray areas, no compromising with load or letting them do more. That's all I got in the video. Hey, if you like the video, share any insights you might have gotten in the comment sections below. I try my best to respond to all of them. You can also share this with other providers that might help. And lastly, go download our free training modules. Links for that are wherever you're consuming this. We really go through the full system from start to finish, helping you get on the path to providing less services and more solution-based treatments and cutting the treatment times by 50% so you can help more people, make more money, and just do great work. I appreciate you watching, and we'll see you on the next one. Bye.